Chairman Isaacson and Miller, ranking members Blumenthal and Brown, and members of the Senate House Veterans Affairs Committee. It's my honor to represent the 1.7 million members of the Veterans of Foreign Wars of the United States and our auxiliaries. During my time as commander, I've traveled around the United States and multiple countries around the world, talking with veterans and active duty military personnel. I've seen firsthand the effects that medical appointment wait times, delays in compensation, and pension decisions, and concerns for military transition by our troops, veterans, and their families. The VFW is on Capitol Hill to bring a unified voice for these men and women, America's true heroes. This experience, along with thousands of responses to our survey and calls for assistance through our toll-free help hotline, gives me a clear understanding of what veterans around the country are experiencing and what their expectations for health care and benefits are. Because of this feedback, we understand what is working from the user's perspective and what needs to be improved. Today, I bring the VFW's recommendations on how to improve the delivery of health care and benefits to our veterans. We agree that Congress must take a comprehensive look at VHA to fix what is broken, and we will work with you to identify problems and make those needed changes. But let me be clear, the VFW is absolutely opposed to the privatization of the VA healthcare system. It cannot be replaced, and we will fight any efforts to do so. Moving forward, the VA needs a sufficient budget. The administration's request nearly matches the independent budget recommendations, except for construction. Funding for these accounts must be increased to finish current projects and to begin work on those facilities that pose safety threats to veterans, their families, and employees. Our latest choice survey indicates that nearly half of the veterans who believe they are eligible for the choice program have been given the opportunity to participate, and that is up 20% from the previous year. VA must continue to improve the program to ensure all veterans who are eligible for choice are offered the opportunity to use it. The majority of choice program complaints are scheduling community care appointments and veterans being improperly billed for care when the VA should pay the bill. Both are due to delays in the transfer of medical documentation and authorization for follow-up care. VA is working on several IT projects to address this concern, which the VFW supports. Congress must provide VA the necessary resources that they have requested. Congress must also act on VA's proposal to consolidate its community care programs. This consolidation is critical to the overall health, care, and delivery transformation. The VFW supports Secretary McDonald's My VA transformation, which encompasses numerous programs geared toward improving veteran and employee experiences, their training, support services, performance, and strategic partnerships. The VFW realizes this transformation will take time to implement, so we urge Congress to work with the VA on My VA initiative to ensure these programs succeed. Any plan to reform the culture of the VA must also take into consideration the need to modernize its workforce. VA must be able to recruit, train, retain, and properly pay high-quality healthcare professionals for our veterans. Changing the culture of the VA also means changing the culture of accountability. VA must have the proper authority to properly discipline employees whenever appropriate. Regarding health care, when and where veterans need to be seen must be a clinical decision made between a veteran and his or her doctor. This is why the VFW believes that VA must integrate the capabilities and strengths of all existing healthcare resources in local communities, to include public and private community providers. The VFW supports the VA's plan to develop a nationwide system to deliver urgent care. But these options cannot increase the cost of co-payments or fees. The last component in transforming VA healthcare delivery and capital infrastructure, the VA must be given the authority to enter into public-private partnerships and broader sharing agreements